Knock, knock, knock. Hi, good morning. My name is Daniela Garcia. I am going to be your student nurse for today. I'm going to go ahead and wash my hands, put my gloves on, close the curtain to provide patient's privacy. Good morning, Mr. Bear. Could you please state your name? What is your date of birth? The patient states his date of birth. Okay, great. Can I please see your ID bracelet? Okay, great. Your ID bracelet matches the information that I have with me. Alrighty. Mr. Bear, now can you please tell me, do you have any allergies or any allergic reactions to anything I should be aware of, such as latex? Okay. Or any additional medication? Okay, the patient states he does not. Okay, great. Do you have any cultural considerations that would prevent me from doing my assessment today? The patient does not. Alrighty, I am going to go ahead and be doing a head-to-toe assessment to you today. I'm going to go ahead and raise the bed to a good working height. Could you please tell me on a scale from 0 being no pain and 10 being the most severe pain you've ever had, if you have any pain today? The patient states he does not have any pain. Could you please tell me where you are? The patient states he's at Galen Hospital. Okay, great. What is today's date? The patient states the date. Could you please tell me who is the President of the United States? The patient states the President of the United States is Donald Trump. Okay, great. The patient is alert and oriented ×4. Okay. Alrighty, I'm going to go ahead and assess the patient's scalp to check to see if there's any bumps, lacerations, or any cuts. There are no cuts. The patient's hair is kept well groomed. There is no signs of lice or anything else. Everything looks good. While I'm here, I'm going to go ahead and feel for your sinuses. You have your frontal and your mastoid. I'm going to go ahead and feel your lymph nodes. You have your preauricular, your postauricular, your occipital, your parotid, your jugular gogastric, the mandibular, the mental, superficial cervical, deep cervical, posterior cervical, and supraclavicular. Was there any sensitivity in those regions? The patient states there were no sensitivity in those regions. Okay, great. Next, I'm going to go ahead and feel your ears. I don't see any excess cerumen and there is no redness. Was there any sensitivity while I was doing that? The patient states no. Okay, great. Alrighty, I do not see any jugular vein distension with the head of a 30-degree angle. I'm going to go ahead and assess your carotid pulse. Alrighty. The pulse says 2+ regular. Okay. I'm going to go ahead and remove my gloves and wash my hands. Okay. Now I am going to go ahead and inspect your nose and your mouth. If you could just lean back for me just a little. Okay, great. I do not see any redness or swelling and your septum is midline. Could you please open your mouth? Do you have any dentures? Okay, the patient says he does not have any dentures. I'm going to go ahead, shut the lights off, and inspect your visual, okay? Okay, I'm going to go ahead, come in from the side with my pen light. Okay, pupils are 3 millimeters. Round and reactive to light. And they are accommodating. Okay, great. I'm going to turn the lights back on. I see that your conjunctiva is pink and your sclera is white. Your eyelashes and your eyebrows are intact. Okay, great. Now, can you please just read the chart that it's behind me and read the lowest line that you can't? Okay, the patient has read the lowest line. Perfect. It looks like you have 20/20 vision because you can read from 20 feet away the lowest line. Okay, great. How often do you do self-testicular exam? Once a month? Perfect, that is good. Now, if my patient was a female, I would ask her, how often does she do breast exam? And the answer that we would be looking for is once a month as well. Okay, great. Now I'm going to go ahead and inspect your neck and the top of your chest. And feeling for your trachea, your suprasternal notch, your angle of Louis, and I see that the costal angle is 90 degrees. I see no lumps or bumps or signs of laceration, no redness or edema. Next, I'm going to visualize your respiratory rate. So if you can just please lean forward and let me just assess your respiratory rate. I am going to be counting for 1 full minute. Perfect. Your respiration is at 16. They're even and unlabored. I see that your chest is symmetrical and you have equal rise and fall. Okay, I'm going to go ahead and listen to your lung sounds. I'm going to go ahead and put on my stethoscope. Okay, going to go ahead and listen to your lung sounds with a full breath in each spot. I'm going to start with your tracheal, bronchial, bronchiovestibular, vestibular. Everything sounds normal, okay? If you can just lean forward for me, I'm going to go ahead and be assessing the same breath sounds that I assess in the front. I'm going to go ahead and assess them in the back. Alrighty, so tracheal, bronchial, bronchovesicular, vesicular. Okay, great. Now we're going to go ahead and do a few tests for your back. If you can just please lift your shoulders for me with my hands on your shoulder. Okay. I don't feel any crepitus and you have bilateral strength. Now I'm going to go ahead and palpate for tactile firmness. If you can just please say 99 every time you feel my hand in your back. 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99. Okay, great. Everything feels normal. Okay. I'm going to go ahead and listen, and I want you to repeat 99 for me. We are assessing for any broncho phony. Okay. 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99. Okay, great. Everything sounds normal. Next, we're going to go ahead and assess for any echophony. If you could just say E sound for me, that'd be great. Anytime you feel my stethoscope. So just give me a second. Okay. So we got E, 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 E. Okay, great. Okay, next we're going to go ahead and be assessing for one more test. This is going to test for any pectorallicary. I'm going to have you say 1, 2, 3 anytime you feel my stethoscope. So let me put my stethoscope back on. Okay, great. All right, ready? 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. And 1, 2, 3. Okay, great. All right. Okay, I'm going to go ahead and feel you for for your thoracic cage to see if you have any rise or fall. Okay, I see equally rise and fall. Everything looks normal, Mr. Bear. Your coastal angle is 90 degrees and the back as well. Okay. Next, I'm going to go ahead and have you lean back and listen to your heart sounds. Okay. Alrighty, so we have your aortic. We have your pulmonic. We have the Erb's point. We have the tricuspid. And we have the mitral. And I have listened for a full minute in each region for 1 full minute. Okay, now I'm going to go ahead and listen to his apical pulse for 1 full minute so that I can get a pulse. Okay, I've listened to it for 1 minute and I see that the pulse is 70. Okay, I'm going to listen with the bell of my stethoscope to hear for any murmurs. Okay, great. I hear your normal S1 and S2 sound. Everything sounds good. Next, I'm going to go ahead and inspect your abdomen. I would have, in this case, my patient exposed, but for the purpose of this CPE, I will not. I do not see any bumps, lumps, or edema. Any lesions? Nope. No lacerations or lesions noted. Okay, great. No exudate or no pulsation. Next, I'm going to go ahead and auscultate for a fourth quadrant. So we have the right lower quadrant. We're going up to the right upper quadrant, the left upper quadrant, and then the left lower quadrant. I hear normal valve sounds, so everything seems and hears normal. Next, I'm going to go ahead and palpate the 9 regions of your abdomen. Starting with the right hypochondriac, starting with the epigastric. We're going to start with the left hypochondriac, then the right lumbar, the umbilical, the left lumbar, right inguinal, hypogastric, and left inguinal. Did you feel any sensitivity while I was doing that? The patient states no. Perfect. Next, I'm going to feel for your femoral pulse and then lymph nodes in your inguinal area. Let me go ahead and remove these gloves and put a new set of gloves. Okay, great. Alrighty. Go ahead and put this on. Okay. So your femoral pulse is 2 plus regular. Then I would feel for the upper inguinal nodes and the lower inguinal nodes. Was there any sensitivity while I was doing that? The patient states no. Okay, great. Moving on. Now I'm going to go ahead and have you turn on your side. I'm going to go ahead and inspect the lower back and sacrum. I see no redness, no pressure ulcers or swelling. Everything looks good. Okay, you can go ahead and lean back down. Great. Now I'm going to go ahead and assess your arms. Do you feel any dizzy at all? The patient states no. All right, the patient is going to be sitting up. I'm going to have you lift your hands, lift your shoulders with my hands on your shoulders. Okay? Perfect. I don't feel any crepitus. I'm going to remove my hands. Okay. You can lift your arms for me. Lower them. Bend at the elbows. The patient is bending at the elbows. Okay, now the patient is bending at the wrists. Perfect. I see that you have no bumps, no swelling, no lesions, or exudate coming from your arms. If you can grab my fingers for me, if you can squeeze, 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 squeeze. Okay, perfect. I see that you have equal strength. I can see that you don't have any tinting. Okay. You have the capillary refill less than 3 seconds. Okay, great. Next, if you can close your eyes for me, if you can tell me which finger I'm touching on each hand. So in this case, I would be touching the right thumb and then the left pinky. Okay, great. The patient states what I touched, which was the right thumb and then the left pinky. Okay, great. Now I'm going to palpate for your brachial, your radial, and your ulnar pulse on each arm. Okay, beautiful. I see that is 2+ regular on both arms. Okay, great. Now I'm going to go ahead and assess your reflex on both arms. I'm going to right here to test your brachial reflex. Okay. Next, I'm going to do your brachial radialis. Okay. Next, I'm going to have you lift your arms up and test for your triceps reflex. Okay, great. Everything looks good. Now I'm going to go ahead and feel for your axillary nodes bilaterally. I'm going to go ahead and assess your epitrochlear nodes bilaterally. Any sensitivity to that? The patient states no sensitivity. Next, I'm going to go ahead and test your leg reflexes. I'm going to be using this to test for leg reflexes. Okay, great. Okay, I'm testing for your quadricep reflex. Okay, great. Okay, great. Now I'm going to test your Achilles. Okay, great. Great. While you're at the edge of the bed, I'm going to go ahead and assess your pulse to see if you have any orthostatic hypotension. Okay, great. All right, let me know if you get dizzy. Okay, so the pulse is 72. Before you stand up, I'm going to go ahead and lower the bed to the lowest. I'm going to go ahead and put the safety socks on and lock the bed. Lock the bed, put the socks on. Okay, great. Now the patient is standing. Do you feel dizzy at all? The patient indicates he is not dizzy. Okay, perfect. Right now, I'm going to go ahead and assess your pulse again. Let's see. Okay, great. So it is 74. All right, can you please take 5 steps forward for me? The patient is taking 5 steps forward. The patient has completed the 5 steps forward. The patient now is doing 5 steps backwards. Okay, great. Go ahead. Perfect. Can you bend forward and touch your toes? Okay, great. The patient has leaned forward and touched his toes. Perfect. I do not see any scoliosis, lordosis, or kyphosis. I see that your thoracic cage is a 1:2 ratio. and everything else is symmetrical. Now I'm going to have you lay back down, and now access the rest of your lower extremities. Okay, great. I do not see any lesions, bumps, edema, or swelling. Okay, good. You do have capillary refill. I'm going to assess your palpebral pulse. Okay, so it is 2 plus regular. Okay, dorsopedialis pulse. Okay, great. 2 plus regular. And your posterior tibial pulse. Okay, perfect. Going to go ahead and do that bilaterally. Popliteal, dorsalis pedis, and posterior tibial. They are all 2 plus regular. Now, if you can please close your eyes and let me know what toe I'm touching. Okay, great. So the patient has stated that I touch his right big toe and then his left pinky. Okay, great. And now if you can just push my hands against your feet. Push, 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 push. Okay, great. Now I can pull against them. Pull, 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 pull. Okay, great. Good job. That lets me know that you have bilateral strength. Okay, I'm going to go ahead and give you the call light. Here is your call light. The bed is at the lowest position that it can be. The bed is locked. I'm going to go ahead and wash my hands. Open the curtain, and I'll be documenting everything at the nurse's station. Please let me know if you have any questions. Thank you.